Polycystic Ovarian Syndrome. PCOS is numerous small cysts, fluid-filled sacs, that form in the ovaries. PCOS is a syndrome of ovarian dysfunction along with the cardinal features of hyperandrogenism and polycystic ovary morphology. Polycystic ovaries, as observed on ultrasound, are prevalent in approximately 25% of all women, but may not always be linked to complete PCOS. This condition, affecting approximately 5–10% of women of reproductive age, is associated with an increased risk of type 2 diabetes and cardiovascular events. The etiology is not completely clear, and factors that might play a role include heredity, hyperinsulinemia, and elevated levels of androgen. Risk factors are a family history of menstrual problems or disorders, type 2 diabetes, being overweight or obese and fast weight gain. Clinical features are oligomenorrhea, amenorrhea, hirsutism, subfertility, obesity, recurrent miscarriage, acanthosis nigricans, and may be asymptomatic. The diagnosis involves identifying patients with 2 out of 3 features, amenorrhea or oligomenorrhea, clinical or biochemical hyperandrogenism, presence of polycystic ovaries on ultrasound examination. The ultrasound criteria for diagnosing polycystic ovarian syndrome include presence of 8 or more subcapsular follicular cysts measuring less than 10 millimeters in diameter, an increased ovarian volume exceeding 10 milliliters, a hyperechoic central stroma, and the characteristic peripheral location of follicles, often referred to as the string of pearls sign, with follicles of similar size ranging from 2 to 9 millimeters. The management involves the use of combined oral contraceptive pills and cyclical oral progesterone to regulate menstruation. Metformin is recommended for patients with PCOS, particularly those with hyperinsulinemia and cardiovascular risk factors, but it should be discontinued upon detecting pregnancy. Clomifene is employed to induce ovulation in cases of subfertility. Additionally, lifestyle advice, encompassing dietary modifications and exercise, is emphasized for weight reduction and the management of hirsutism. The management of hirsutism includes various approaches such as the use of eflornithine cream, cyproterone acetate, and metformin. Additionally, GnRH analogues with low-dose hormone replacement therapy may be employed, and surgical treatments like laser or electrolysis can be considered for effective and comprehensive care. Complications are infertility, gestational diabetes, pregnancy, induced high blood pressure, miscarriage, premature birth, non-alcoholic steatohepatitis, metabolic syndrome, type 2, diabetes or prediabetes, sleep apnea, and an increased risk of depression, anxiety, and eating disorders. Additionally, there is a heightened risk of developing cancer of the uterine lining, specifically endometrial cancer. Thank you for watching. Subscribe for more videos.